fever, it is caused by Coxiella burnetii, which is a gram-negative bacteria, and it is pleomorphic, which also is highly infectious bacteria. So it is seen in Rajasthan and Punjab, and it affects the heart. Coming to pathogenesis, these cattle, sheep, and goats inhale this bacteria from the soil. So once they inhale the Coxiella burnetii, they get infected by it. Their secretions like milk and feces contain this bacteria. So when the human comes in contact with the feces or the milk, these bacteria enter the human's body and goes to the macrophages. And in macrophages, normally it should undergo phagocytosis, right? But this bacteria escapes the phagocytosis and survives in the acidic environment. The body creates autoantibodies which attacks our own heart. So coming to clinical features, these are in 3 stages. One is the acute Q fever, post Q fever, and the chronic Q fever. In the acute and the post, there is fever, right? So in the acute, you need to remember there will be involvement of heart, that is myocarditis and the pericarditis. And in the post, there will be involvement of joints like myalgia, arthralgia. And in the chronic, there will be involvement of heart, but it is inner layer, that is endocarditis. So the first two, fever will be there, and the last one, no fever. And the first is involvement of heart, which is myo and the pericarditis. And the post, here involvement of joints like myalgia, arthralgia. And coming to the chronic, there will be inner layer involvement, that is endocarditis. Now diagnosis is done by immunofluorescence assay, where the antibodies can be detected. Treatment is doxycycline. Prevention is by Q-Vax, that is the vaccine which is available, and proper animal husbandry practices should be followed, and pasteurization of milk should be done. Good hygiene should be maintained. So this is the diagram for the Q fever transmission. It is transmitted from the cattle to the man. That means it's a zoonotic disease. The contamination from the urine, feces can when it comes in contact with the man, the disease is transmitted.